Hey everyone, good morning. It's Dr. Duane Scotty, physical therapist from Spark Physical Therapy, coming to you live here on a Monday morning. I just wanted to jump on here real quick. As you can see, we're in the lecture dress today. We're going to be giving a little lecture to our first year DPT students about hip surgeries. So indications for hip surgery, what are the types of hip surgery that PTs may kind of get into, but that's really not the main basis for wanting me to jump on today. Today I really wanted to talk to you about reaching for your full potential. I posted that last night. Got me thinking, the weekend's over. Everyone usually slacks off a little bit on the weekends, which you kind of need, right? You need to reset the batteries, recharge a little bit. Maybe you're a little more lax with your fitness goals. Maybe a little more lax with your nutrition goals. Maybe you're watching a little too much March Madness, had some, beverages, and now it's Monday. So maybe we can kind of turn over a new leaf, start a new week. This is where you get to reach for your full potential and can meet your health, your fitness, your running, your nutrition goals. So you get a kind of mulligan here. We get a second chance. So I wanted to kind of hope everyone really can have a great week, get that second chance that they want to get. I was able to luckily get up a little bit got up on time today. So I definitely got up, alarm clock went off before 4, hit the pavement at 4:30, did my normal Monday workout. So I'm ready to rock for the day. I'm going to have a bang up lecture. But I also wanted to kind of jump on here to talk about, because today we're going to be talking about hip surgeries and not such the fact that physical therapists are going to be surgeons, so they don't need to know the intricacies of hip surgery, but they will encounter patients who have had hip surgery and they're getting rehab after surgery, or they might be indicated for surgery. So they might be recommending specific surgeries if that's indicated, because if you were not aware, physical therapists can, at least in most states throughout the country, see patients without a direct physician referral, meaning if you have hip pain and it feels like it is muscular in nature, or you have a hip injury from doing an activity such as running or dancing, or you're a gymnast, and you can go right to your physical therapist. So you can go to your physical therapist without needing to go to, wait for an appointment with your primary care physician, wait to go see an orthopedic specialist. Physical therapists are trained to evaluate, do a thorough history, and then initiate treatment right then and there on the first visit if your problem is musculoskeletal in nature, and they can help you. If it isn't, then they have the knowledge to refer you out to the appropriate provider. But today we're really going to be talking about people that have pain in the front of their hip. So typical pain pattern is you have pain with prolonged sitting. So you're either sitting in your car, like I am. As you can see, I got a low rider car, Honda Civic. And this is something that people may get pain in the front of their hips from, or if you get pain when you squat at the gym. So you have trouble going into like a deep squat, or I'll see dancers who have trouble going into like grand plie. Those kind of motions that position your hip in a flex position. So it's in that bent position, and that gives you pain in the front of your hip. So classically, that pattern is consistent with what we call impingement in the hip. So otherwise known as femoral acetabular impingement, FAI. The main treatment for this condition is to really improve the mobility of your hip joint to kind of glide appropriately, improve that mobility, avoid the provocative activities, so avoid the positions that increase that pain, and then stabilize and strengthen the muscles in and around that hip joint. And most of these folks respond really well to physical therapy treatment and do not need to go to that next level of care of surgery. So I can tell you, speaking from personal experience, I had this surgery 8 years ago. I had a hip arthroscopy. So that's where they go in with a scope. They went in, I had a labral tear. And so that's another thing, is a lot of times we think you have pain, you need an MRI. MRI is going to be able to give you your diagnosis. 9 times out of 10, or even probably more than that, a physical therapist, a physician will be able to come up with the appropriate diagnosis, not really requiring an MRI, a really expensive MRI, to tell you what's wrong with the hip and to tell you what the best treatment is. So the best treatment for this condition that we're talking about of pain in the front of your hips, FAI, is conservative care, so physical therapy. When the surgery first came out 10, 15 years ago, the techniques were new, the technology was new, everyone was getting hip scopes. I got a hip scope. Now that we know we have longer data and we have more robust research, we know that conservative care, most patients do better, or they get the same result with seeing a physical therapist and rehabbing the hip without needing to actually get a surgical procedure to take care of that. How you doing, Laura? What's up? Thanks for jumping on. So we're talking about the importance of getting the right diagnosis, knowing what your condition is, and then for people who have pain in the front of the hips, it is really conservative care versus surgery, even though I will be lecturing on these specific surgeries this morning. But that's really my message to these future physical therapists, is knowing when to refer out, know your red flags, refer out to an orthopedic specialist when it is indicated, and then really educating their patients. So educating, the public, which is I'm trying to spread that word, is that conservative care, rehab, seeing a good physical therapist in your area will get you the results that you want to get back to the activities and the sports that you love. All right, so I just want to jump on here, going back to the initial message. It is Monday, new week, so reach for that full potential, everyone, whether it's a work goal, fitness goal, health goal, nutrition goal, whatever it is, get it done today. New week, new you. Have a great day, everyone.